take over the session. Welcome to you, sir.
Okay. In the last session, we had discussed about the kshudraroga, and the next of the kshudraroga, in continuation of that, Pama, Vijartika, Kushteshu, Rakasa, Praketika, Pama, Vijartika, and Rakasa. These are mentioned in the chapter of the Kushta, and Sushruta doesn't mention in any detail of these diseases in the kshudraroga chapter. Of course, then there is a question like when to consider these conditions as kushta and when to consider them as kshudraroga. I don't have a definite answer for that, but most possibly when the symptoms are relatively milder, we may consider this as a kshudraroga. When the symptoms are more severe, it may be considered as a kushta as such. Now, to remind you about whatever we have discussed about the features of Pama, Vicharchika, and Rakasa in the previous chapter of the Kushta again I will repeat that whatever we have discussed same. In case of the Pama, it's a Sasrava Kandu Paridahakabihi, Pama Anukabihi, Pidakabihi, Uhya, Sputihi, Sadahi, Adisaiva Kachuhu, Spik Panipal Prabhuvehi Niropya. The small eruptions which would present with itching and burning sensation and usually concentrated in the areas where the hygiene is difficult to be maintained, like buttocks in the fingers, etc. That's exactly what you see in case of the scabies. So scabies may be considered as a pharma. Now whether it has to consider kushta or the kshudraroga, when to consider kshudraroga, when to consider this as kushta, difficult to say that. Then, in case of the Vichachika, the typical features are when there are the ridges over the skin surface. The lesion presents with the ridges, longitudinal line like appearance. That's Rajyaha, Atikandu, Artirujaha, Sarukshaha, Bhavanti Gatreshu Vichachikayam, Kandu Mati, Daharjopapanna, Vipatika, Padagate, Eva. Vichachika and Vipatika, depending upon the location, when the same occurs in the pada. Foot, it is Vipatika, when it occurs elsewhere, it is considered as the Vichachika, where that line like appearance is seen, and these gay or lines are a characteristic of environment of the subcutaneous tissue, the elastic area over there. When the elastic tissue becomes affected, it presents with the ridges over the skin. That's what we call as elastolysis. And anyway, that's what we generally consider as an eczema. Then Rakasa is Kandalmita Yapidaka Shirine Samsravahina Rakasa Uchede. The eruptions, drug eruptions like conditions where there are not much of discharges or erythema multiforme like conditions may be considered as the Rakasa. Now we continue with the further the Kshudraroga. The other Kshudrarogas are Padadari. Padadari Parikramanashilase Vayu Atyartharukshayoho Padimuhu Kurte Darim Sarujam Tarasamshilha. That's exactly what we call as a cracked foot. Now, in that condition, Sushruta says it's because of the habit of walking a long distance without having some protections. When the skin gets cracked, the plantar surface skin gets cracked, that's considered as a bandar. Now, when we see these patients of this cracked foot, the most of the times it is due to sensitivity to the chemicals. Like those who use fancy footwear with the plastic or certain other chemicals, they tend to produce the irritation and hence there would be hyperkeratosis, thickening of the keratin tissue. Friction with the hard surface, like those who do manual labor without the footwear, also may develop the cracked foot. But from the current point of view, the most frequent cause for that would be sensitivity to the chemicals like plastic. So when you use these footwear, which are either having the chemicals like plastic or footwears with the fancy wear, there could be a compression, pressure over the area. There could be again resulting in the hyperkeratosis. Different pointed shoes, pointed chappals, and so on. That when they produce the pressure on the area, that too can produce the same. Interestingly, footwear are maintained to protect the foot, but now, because of the fashion sense, the footwear themselves could be a cause for the irritation and the lesions. Like then, the next is about the Sharkara or Padakantaka. Sharkara Unmachite Pade, Kshate Kantakadihi मेधो रक्तानुगश्चैव दोषैर्वा जायतेन्द्रं सकील कठिनो ग्रन्थिः निम्न मध्योन्नतोऽपि वा कोलमात्रः सरुक्स्रावी जायते कदरस्तु सः. Kadara or Parakantaka is the next part of the next type of the Kshudraroga. Kadara is produced due to a injury by a pointed object like a crystal or sand crystal or these thorns and such, and when it involves the medas and rakta, it produces a kilakathinaha, something which looks like a nail. In the contemporary this local language, we use the word ani. Ani is the same nail, and the same word is used by Sushara. That's a very interesting issue. When it produces a swelling of that sort, which is hard over the surface of the foot, plantar, or at times palmar surface, it's it may have a depressed central area where the central area has become necrosed or raised surface. That's the kadara. Now, these are the corns and the warts. We use the word corns when there is a projection over the surface. Warts are when there is a necrosed, the area, central area has become necrosed. This again is a hyperkeratosis. The cause for the hyperkeratosis could be two forms. One, there could be a lesion of a previous injury, and hence the skin, that the substantia nigra of the skin, the layer, it tends to go project into the deeper tissue. See, it's a keratin tissue layer up to the level of the substantia nigra would be having a flat orientation, or it covers the surface. But if it is penetrating in, then it may grow into the tissue, which again is produced due to the friction, usually like thorns or so on, or maybe the footwear. Again, the same could be the cause for the thorns. Or the other way, the corns could be due to viral infection. Certain virus also can be cause for the corns. The differentiation clinically would be the corns produced due to the pressure changes. They are usually seen on the middle of the plantar surface where there is a pressure, like below the toe or so on. Whereas warts, which are produced due to the viral infections, they can occur anywhere, and they are usually multiple. Corns are usually lesser in number, and they are present in the pressure source. Corns also are triggered due to a reduced sensitivity of the foot. Patients like diabetes mellitus, leprosy, etc., they have a high chance of developing the corns because the sensitivity is lesser, and as the sensitivity is lesser, they have a higher chance of that breaking injury, and that later on results in the corns. So, in case of the injured conditions like pressure sores which are produced due to either lesser sensitivity or the previous injury, the treatment is relatively simple. That keratin tissue has become made softer, and to make it softer, that regular cleaning with warm water could be a best of the treatment than the real surgical excision. Surgical excision often can result in more and more deeper lesions as such. Whereas in case of the viral infections, none of these handling would be helpful. They need to be handled in a different fashion where you may have to avoid that growth of the virus is in the body, or the viral infections also may have a spontaneous termination. They may end by themselves. Then the next is about the alasa. Alasa is a Klina Anguli Altaro Palo, Kandu Dahar Ganito, Dusta Kardama Samsarashada, Alasam Tam Vinidisheta. It's web space infection. The infecting lesions which are produced between the toes, the space of the two fingers, which is really produced due to a mechanical cause. Like as the space is lesser, and it's difficult to maintain the hygiene, and most commonly it is seen in the workers who work in the field, and they tend to keep that area moist. Or the risks also are more in patients like diabetes mellitus, where the web space is more prone to get infected, and characteristically it presents with initially very superficial these erosions with discharges, often foul smelling, and that typical color also is seen. That's exactly what Sushil has mentioned. Clean now, when it becomes moist, and there will be some amount of oozing produced in between the angulis, and this usually produced due to contact with the dustakardama, that's the dirt as such. So that's exactly the web space infection which we see now. Then the next is about the Khalitya as such. Khalitya is cases of hair loss. Now, Khalitya in Sushruta, you have two contexts of the Khalitya. Khalitya is also called as Indrautta or Rujya by Sushruta. In the later on, you'll find the Khalitya as a separate disease also, whereas in the Kshudraroga also Khalitya is mentioned. Now, the differences could be based upon the etiology as well as the course of the disease. The Khalitya is due to the loss of hair, conditions of loss of hair. Now, loss of hair clinically can occur due to two reasons. One, what we call as android alopecia, where the loss of the hair is due to hormonal changes which tend to occur in the people, or due to the local factors. Now, local factors again can be of reasons like a fungal infections, alopecia areata, or due to continuous friction, that's also called as a traction alopecia, where due to continuous friction or habit of plucking the hairs, some areas of the scalp may have loss of hair, and usually it's of psychiatric origin. So in alopecia areata, it's due to the fungal infection where there would be some islands of hair loss, and the skin at that area may show the signs of inflammation. Whereas in case of the traction alopecia, there would be some history of a pressure or traction pulling out of the hairs over the area. It can occur in a bedridden patient where continuously the pressure acts upon the area that the hair loss could occur. Now, most possibly, when Sushruta mentions about the kshudraroga Khalitya, it's about these spots of hair loss, either alopecia or the traction alopecia. Whereas the android alopecia may not be included in the kshudraroga. This again a point of debate. Anyway, so when we say Khalitya, Indralupta, Rujya, the typically features mentioned by Sushra due to the vitiation of Pitta and Vata. Roma Kupanagam Pittam Vatena Sahmurtitam Pratyavaita Romani Tatashleshma Sashonita Runabhi Roma Kupamsto Tato Anyasham Asambhavaha Tad Indraluptam Khalityam Rujyetika Vibhavete. Now Sushra says because of the Roma Kupas, the hair follicles getting affected, there will not be further growth. But in case of the alopecia areata and traction alopecia, the regrowth of the hair is possible. Whereas in android alopecia, now from the clinical point of view, to differentiate the android alopecia, the pattern of the alopecia is very characteristic. And the usual patterns which are discussed are initially it starts with the hairline moving up, and then gradually it changes, modifies, the hairline goes up and up, and then gradually it results in the hair loss. So this is the typical different patterns of the android alopecia which we see, and it's classified and they are even noted like with that specific numbers like type 1, type 2 and type 2A and so on, depending upon the pattern of the hair loss. And in these conditions, there will never be a recovery of the hair loss because in the android alopecia, the hair follicles are completely destroyed and there will be total atrophy. So, whether android alopecia also has to be considered as a kshudraroga or not is a point of debate. Anyway, from my point of view, I would not consider this android alopecia as a kshudraroga, whereas the alopecia areata or the traction alopecia are may be considered kshudraroga because the management there is easy with care about prevention of the cause. You can cure that condition. Whereas in the android alopecia, there is absolutely no medical cure. The other way is hair transplant and so on. Anyway, that's one point, and more of that discussion we'll have when we go into the chikitsa, the treatment there. Now, the next is about dharnaka. Dharnaka is a condition again related to the hairs, hairy area of the body, the scalp. Dharna kandura ruksha kesha bhumi prapatite. Kapha vata prakopena vidya dharnakam tam. Now, dharnaka is that condition where the area of the scalp, skin of the scalp, is having cracks and hence results in the destruction of the skin or plaques over the skin area. That's what we call as the dandruff. Now, that's or a similar description of what Sushila has mentioned, like Keshabhumi Prapatite, also can occur due to the ticks, pedicles, like the typical pedicles, that pediculus humanus capitis, which is also called as halo in Kannada. Now, that also can produce that similar eruptions over the skin, and localized areas of the irritation. So both of them can be considered as Dharanaka. In case of the dandruff, which is more common, the often the cause is supposed to be irritation of the layer, skin layer. And the most common cause for the dandruff now in the present day situation is the anti-dandruff shampoos. Shampoos which are used as a fancy material, which are supposed to protect the person from the dandruff. They themselves are the cause for the dandruff. That's a very important issue, which is may often maybe may not be really discussed in detail. But the fact is, the keratin tissue, what happens in the dandruff, the pathology is the keratin tissue becomes fragile and thin layers of the keratin they tend to get separated. Something like that of the psoriasis, not exactly the psoriasis. Of course, psoriasis condition also can present with the similar presentation of the dandruff-like presentation. Now, the whole concept of the anti-dandruff shampoos is they tend to remove that plaques by irritation, and this continuous irritation would be further triggering that irritation of the keratin tissue, and it's a vicious cycle. As long as you use the shampoo, you will not see the plaques, but the moment you stop using the shampoo, the plaques will continue to be there, and hence they are claimed to be the anti-dandruff. But real treatment would be like actually this is a introducing or inducing a vicious cycle of continuous irritation of the keratin tissue, and so that for lifelong you have to use the same that these anti-dandruff shampoos. Instead, if you avoid that irritation, probably many of the dandruffs can be prevented or managed better. Anyway, that's the point, and more of that we will discuss when we discuss about the treatment there. The next is about Arumshika. Arumshika are multiple eruptions which are Bahuvaktrani, Bahupledini, Murthani, Kapasu, Krimikopena, and Ram, Vidya Arumshika, where the hair follicles they tend to get infected. The folliculitis is the hair follicles get infected. Now, this is again a very frequent feature, again often related to the irritation of the skin by the chemicals. Most of those your cosmetics which are used, they could be the real triggering factors for the folliculitis. At times it could be due to the other reasons also. Environmental factors also can produce the same triggering of the follicles, or at times it could be the other local infective lesions. Now, anyway, the typical appearance would be there will be multiple swellings in the hair follicle area, small swellings, which may even be quite painful, and there could be even discharges. Purulent discharges could occur, and these are very common conditions, the folliculitis as such. More of that we will discuss when we go into the treatment. The next is about the palitya or palita. Now, palitya is a graying of the hairs. क्रोधशोकश्रमकृतः शरीरोष्माशिरोगतः पित्तं च केशान् पचति फलितं तेन जायते. Premature graying of the hairs. Graying of the hairs at certain age is a normal physiological phenomenon, but when it occurs in at an early stage, it's considered as the disease as such. So palithya is the same, and according to Sushruta, it's triggered due to the emotional disturbances, krodashoka shramakratah, due to anxiety or anger or so on, and maybe even the stress, physiological stress, can result in the involvement of the hairs by the heat of the body. This is exactly what Sushruta has mentioned. But practically, when we see the conditions of the premature graying, either there could be a genetic tendency, but more often it's due to the chemical onslaught. Chemical onslaught. Now these days, there is a one fashion of coloring the hairs. You'll have multicolor hairs like so. So on. Now I'm not commenting on that part. And most of the times, these chemicals which are used to present the hair in a different fashion. So that lots of processes are there. If you go to the beauty salon, you will see find the hairs processing, different sorts of processing of the hairs, like washing with ammonia and then applying some chemicals and so on. Lots of things are there. I'm not going into that part. But that itself could be one of the causes of the premature graying in majority of the conditions. Genetic is another factor as such. Now that's about one. The next is about the masurika. Now, Masurika is also mentioned in the Kshudraroga, and it's also mentioned in the later on in the Janapadodhvamsa Vyati. So there again you have the similar question like when it has to be Janapadodhvamsa Vyati, when it has to be considered as a the Kshudraroga. But clinical features of this would be very much typical of the varicella infections, or what we call as chicken pox. The typical appearances would be दाहद्वार रुजाबन्धः ताम्राः स्फोटाः सपीतकाः गात्रेषु वदने च अन्तः विज्ञेयाः ते मसूरिकाः. Masurika, they are presented as vesicular eruptions which may be either reddish or yellowish later on, and they also tend to occur in the mucosal surface. That's again quite important, that eruptions, vesicular eruptions which involve the skin as well as the mucosal surface. This is typical presentation of the chickenpox or the viral infective pathology. Eruptions which may occur without involvement of the oral cavity, there are different conditions. So when they to confirm about a chickenpox clinically, the examination of the oral cavity is a general guideline. Involvement of oral cavity confirms the chickenpox in the clinical practice, and that's exactly what's mentioned by Sushruta. So Mazurika are obviously the chickenpox like conditions. Then comes the Akan or the Mukhadushika. मुखदूषिका शाल्मलीकण्टकप्रख्याः कफमार्दशोणितैः जायन्ते पिडकाः यूनां वक्त्रेया मुखदूषिकाः. The eruptions which are on the face, usually in the younger age, they are considered as the mukhadushika or akan. Now, the akan are of different categories. We generally categorize the akan depending upon the clinical presentation as a blackheads, whiteheads, papules, pustules, or nodules depending upon the presentation. And all of them, they are primarily produced due to the obstruction of these glands, or they also are related to the hormonal changes. The hormonal changes which occur in the body during that young age, they stimulate these ceruminous glands to produce more of these secretions, sebaceous secretions. Sebaceous secretions are produced in larger quantity in the face, which often is identified as oily phase now. And this itself can be a cause for the obstruction later on. It may get concretified, the secretions, maybe sebaceous secretions may be blocked, and depending upon the amount of that issue and the possible inflammatory changes over there, they may be presented as blackheads, whiteheads, or papules, bigger ones, or pustules. It may have a pus formation, or later on it may become fibrous and the nodules could be formed. Most of the times, the initial mild conditions are blackheads or whiteheads, and they can be easily managed by simple physical cleaning. Regular washing with the water would be a best treatment to prevent them from going into the next stage. But most of the times, when they again are mishandled by application of certain substances, and most of the times the cost will be again the cosmetics which produce a waterproof surface, which can reduce that effect of the sweating over the makeup, what we call as the foundation of the makeup. They themselves could be a cause for the obstruction, and due to this repeated obstruction, the agent may turn out into the later stages like papule, pustule, or nodule, which may produce a permanent scar. Whereas blackheads and whiteheads do not produce a permanent scar. So, based upon these effects, we now classify agent into these five categories, whereas Sushruta has mentioned them as a Damkhadushika as such, or Yavana Pidaka. The other name given is Yavana Pidaka also. And more of these therapy issues we will consider when we go into the Chikitsa. Then the next is about the Padmini Kantaka. Padmini Kantaka is a Kantakaihi Ajitam Mruttam Kandu Matu Pandumandalam, Padmini Kantaka Prakshihi Tarakyam Kapavatadam. The Kapavataja disorder which presents with the a thick horn-like appearance over the skin surface. Now, this horn-like skin surface is suggestive of the abnormality of the carotid tissue, which we call as hyperkeratosis. Hyperkeratosis in children can be produced due to the deficiency like rickets-like conditions. Vitamin deficiency can result in hyperkeratosis, and that's commonly seen in children or very old aged patients where you'll have a widespread areas of these hyperkeratosis. A hyperkeratotic nodules, which are also called as Kyle's disease, are signs of systemic disorders where you will find projections which have an indication, and even it may get infected. You may have some spots of infection. Keratin tissue nodules may be seen, and they are often signs of systemic conditions like diabetes mellitus, hepatic failure, congestive cardiac failure, or renal failure. So, in these Kyle's disease condition, the primary approach to the treatment would be those systemic diseases to be understood, or at times, rarely, though not frequently, these Kyle's appearances could be the clue to make the diagnosis of the systemic disease also, or it can be a complication in case of these underlying diseases. Whereas the other hyperkeratosis could be sign of a deficiency disorder like the rickets or osteomalacia in later stages as such. So that's about one. Then the Jatumani is a నీరజం సమముత్సన్నం మండలం కపరక్తజం సహజం రక్తమీషత్య శ్లక్షణం జతుమణిం విదుః. Jatumani is a lesion which is presented over the surface, and the surface is not much raised. That's exactly what Sushila has mentioned. Samam, it's a sama or utsana. Either it could be raised or sama flat, and limited. The area is limited. Shape is circular. Produced due to kapha and rakta dosha, and usually sahaja. But at the time of the birth, they are the birthmarks, which we call as the nemae. Nemae could be of different sorts. Now we classify the nemae as depending upon the plane of the nemae as either the affiliate is when it is just at the keratin tissue layer, lentigo when it's a keratin tissue layer and the superficial part of the skin is related, and junctional when the subcutaneous and the cutaneous portions are involved, compound when it is deeper, and intradermal when it is much deeper and the whole skin surface is involved. And blue nevus is usually produced due to the vasodilatation, vessels, proliferation of the vessels. Deposition of the melanin tissue at some areas would be producing the nevus, and when there is a hypermelanosis without much of the changes from the normal, or depending upon the plane, we classify them into different classification like junctional or maybe compound or intradermal or lentigo as such. Now, the clinical appearance of these would be like superficial, you will see these just spots, whereas a blue nevus, which is produced due to the vascular dilatation, vessels being dilated, and the others also depending upon the intensity of the color and the surface changes are characteristic of that, that's based upon that. Of course, these are all considered as birthmarks and they do not require any treatment. Only from the cosmetic point of view, they may require to be treatment. But most of the important is they need to be differentiated from the melanomas. Melanomas are the tumors of the melanin produced conditions which tend to increase in size, whereas the nemae, they do not increase in size rapidly. Then the next is about the mashaka. Mashaka is again a hypermelanosis. Whether it has to be considered as melanoma or not is the next part of the question. But Sushil says this condition as a harmless condition, and hence avedanam sthiram teva yasya gatreshu drishyate mashavat krishnam utsanam anilat mashakam vidu. This also is a birthmark. We consider this also nameless. This also is named as nevus. But when the nevus is protruding, particularly compound nevus or maybe the vascular nevi, when they present as a protruding surface, they are considered as mashaka, and this is named based upon the appearance to that of the masha, the black gram-like appearance, blackish raised nodular swelling, which is again present at the birth, and which is not going to produce a harm. That's the mashaka. It's also a nevus only. It's a compound nevus or maybe the vascular nevus, where the surface is raised and presents as a nodular swelling as such. So from the current point of view, you do not make out this as a separate entity, do not give the name of separate entity. A nodular nevus or intradermal nevus also could be considered as the mashaka. But from Susha's point of view, they have given a different name based upon the size. When a similar lesion is presented with a smaller size, tila, then it's considered as a tilakaraka. Krishnani, tilamatrani, nirujani samanija, vatavitta kapokshoshata, pan vidya tilakaraka. Again, these are the birthmarks, nemae, which are spots, small spots, which are called as the tila. And in the regular vocal practice, like particularly in northern India, all the name are named as till, the tila asset, irrespective of the size. Now, conventionally in the folklore practice, when we use the term till, that's not about the size, limited to the size. All birthmarks which are black in color, they are called as a till. So this practice does exist. Sushruta had made out that finer difference based upon the size. So from the current point of view, all of these are the nimai only. Then the other birthmarks are Mandalam Mahagalpam va Shamam va Yadivasitam Sahajam Nirjam Gate Netcham Ityabiliate. Netcha is another of the condition where you will have a bluish colored or whitish colored spot having regular shape. We call this as geographical shape, and that's called as a Nivas Sahajam. It's at the time of birth only. These birthmarks are typically the capillary hemangiomas. Capillary hemangiomas are quite common. A very famous personality, Mikhail Gorbachev, who had that the birthmark as a sign as such. So, and I think most of you know about this personality, Mikhail Gorbachev, the person who made that Russia, the president of ex-president of Russia, and United Soviet Russia was converted into the multiple perestroika and glasnost, the principles of open world. Anyway, I'm not going to that part. That the point is about the typical birthmarks, which are the capillary hemangiomas. Either it could be reddish or blackish or bluish colored appearances, which are seen, and they are quite frequently seen now. And the only difference between the nemi and these are spots having a typical shape, and the surface is not raised, and they may not get blanched like that's the appearance there. Then comes the Charmakila. Charmakila is the produced as a complication of Vrana, healing of the Vrana. Sushra has mentioned Samutthana Nidhanabhyam Charmakilam Prakirtiram. Charmakila is one of the Upadrava of the Vrana. In the context of the Vrana, this is described, and that's exactly what we call as a keloid or hypertrophied scars. Ideally, the scar would grow and fill up the gap produced due to the tissue loss in a wound, and that growth should stop once that gap is filled up. But due to some erroneous progression of the tissue, if it results in a continuous formation of the fibrous tissue, even after the gap is filled, that results in a hypertrophy of the scar, and that's what we call as a keloid. And often these are attributed to the genetic factors. So some people have a higher tendency to develop the keloids due to their genes as such. Then the next is about the Nilika. Nilika, according to Sushruta, are Krodhayasa Prakopitaha, Vayu Pistena Samyataha, Sahasa Mukhamagatya, Mandalam Visudyatataha, Nilujam, Tanukam, Shavam, Mukhe, Vyangam Tamadisheta, Krishnam Evam Guram Gate, Mukheva, Nilika, Vidhu, Nilika and Vyanga. These are the two terms used when there is a spots temporarily seen over the surface of the body, often over the face. When it occurs in the face, they are named as Nilika. When it may occur elsewhere, when it occurs in the face, it's called as Venga. And when it occurs elsewhere, it's also called as Nilika. A temporarily bluish coloration seen over the surface of the body. Now, this bluish coloration seen over the surface of the body is what we call as the hyperpigmentation reactions. They could occur due to multiple causes. The simplest cause could be simply when the skin becomes shrunken. If there is a sudden weight loss, there could be these rings of blackish color seen. So often persons who are ill otherwise, due to some other reason, we use the term ill look. Ill look is when you look at the person, you feel that that person is ill, though the real causes are not made out. So that kind of an appearance where you may have that blackish color around the eyes or around the lips and so on, this is practically due to the shrinking of the skin. The skin becomes shrunken, the pigments they seem to be increased. If you stretch the skin, the color may become normal, or there could be a permanent hyperpigmentation. So hyperpigmentation like appearance could occur when the skin is shrunken, or there could be a real increase in the pigmentation due to previous inflammation, post-inflammatory hyperpigmentation. Any inflammation later on can result in a hyperpigmentation spot. These could be considered as Venga or the Nilika. Now, that differentiation would be if you stretch the skin, In case of that simple factors of the shrinked skin, the color becomes normal. If you stretch the skin, pull the skin apart, the color becomes normal. So, a post-inflammatory hyperpigmentation, that color doesn't become pale when you stretch the skin. That's how it has to be differentiated. Then comes the parivartika. Parivartika is mardanaat पीडनात् चापि तथैवापि अभिघाततः मेढ्रमेधा वायुः भजते सर्वतश्चरः तदा वातोपसृष्टं तु चर्म प्रतिनिवर्तते वणेः अधस्तात् कोशश्च ग्रन्थिरूपेण लम्बते सवेदनः सदाहश्च पाकं च भजति क्वचित् मारुत आगन्तुसम्भूतां विद्यात्तां परिवर्तिकां सकण्डुः कठिनाचापि सैव श्लेष्मसमुत्थिता. Now, parivartika is a situation where, due to physical trauma over the penis, the glans skin, the surface of the skin, would be pulled back and then remains bulged at the below the glands or proximal to the glands, and that again fills up with the exudative fluid, and gradually it may become harder. Now, this is exactly what we call as the paraphimosis. Paraphimosis is that condition where the penile skin is retracted back and doesn't get again back to the position, and they remain there over the swelling. Often it occurs due to the injury during the sexual activity, or it can be due to the catheterization and so on. When the skin is pulled back, initially it will have soft fluid, then it may become harder. Now, Shrishta says when it is softer, it is simply Vataja. When it becomes hardened, it's a Vata Kapaja. It's a Maruta Agantu Sambhuta. Now, very beautiful description. It's a Vataja Vyadhi and the Agantu Karana. There will be triggering factor, the external factors too. So, this kind of a description where the Agantu and the dosha together are described is a very rare description in Ayurvedic text, and this is one of that typical occasion where the external causes as well as doshas are described together in a single sentence. Of course, everywhere that external factors are there in the Nidana, but a classification of the disease based upon this is a very unique as such. Anyway, that's one of the other way point like. Now, anyway, that's a paraphimosis which is commonly seen, and more of that treatment issue we discuss when you go into the treatment. Then comes the avapatika. Avapatika is a अल्पीयखां यदा हर्षात् भालां गच्छेत् स्त्रियं नरः हस्ताभिघातात् अथवा चर्मणि उद्वर्तिते बलात् मर्दनात् पीडनात् वापि शुक्रवेगविघाततः यस्य अवपाट्यते चर्म तां विद्यात् अवपाटिकम्. Where the skin gets cracked due to the injury or the mechanical handling, that's what Sushruta says. Sushruta says like a sexual activity with a partner who has a restricted or maybe constricted opening, vaginal opening, or there could be unhygienic conditions also can be result in the injury, or it could be mechanical injury with the hands. Now, we see such conditions, balanitis-like conditions, quite frequently. It's always attributed to the unhygienic conditions, or at times it could be the reflection of the systemic disorders. Most of the times, balanitis is very common accompanied with the diabetes-like conditions. At times, patients with the balanitis, you simply investigate for the sugar level, you may find that the patient is diabetic. So, incidence of diabetes mellitus and the balanitis coexisting is quite high, and as well as it could be also due to the infective pathology due to the hygiene. And based upon the patterns of that area, we may categorize either as the candidiasis or viral infections, or it could be like the systemic disorders, herpes, genital herpes-like conditions also may have to be differentiated from the simple balanitis-like conditions. Right, that's about the avapatika acid. The next is Niruddha Prakasha. Niruddha Prakasha as well as avapatika, these are the two important issues mentioned by Sushruta. Niruddha Prakasha is produced due to the skin becomes non-retractable. Now, this Parivartika and Niruddha Prakasha Avapatika. These are the three conditions related to the genital area. Parivartika, where the skin becomes retracted and remains bulged. Yes, and whereas Niruddha Prakasha is when it cannot be retracted, it becomes tight, rigid as such. This is also called as what we call as a phimosis. apatica where the skin gets cracked. Now these are interrelated. A paraphimosis can occur in a patient who is a phimotic. A moderate phimosis in that condition, when you powerfully stretch the skin, it can result in a paraphimosis. And the same in the paraphimosis attempt to pull that may result in cracks. So that's why Sushruta has mentioned the description of these very clearly. Vatopasistam evam tu charmam manis charma samsayate manim manish charmopanaddhastu mutrasroto runadhija niruddha prakashe tasmin mandadharam avedaram mutram pravartate jantoho manihi namita iyate niruddha prakasham vidyata durudham cha avapatikam. The same a niruddha prakasha can result in avapatika. Now, the phimosis can be either congenital at the time of the birth itself, it could be, and or it could be acquired later on due to the inflammation. It can be acquired, and depending upon that, usually they are categorized into two. Type one, where the whole skin has that penile skin is otherwise free. Only thing is it cannot be pulled up. Only the opening is narrowed, or where the skin may become adherent. Most of the times required are the type 2 where the skin is adherent only at the tip that there is some collection of the urine, whereas in the patients who have a congenital variety or where the skin is not adherent, when the patient passes urine, the urine may get accumulated at the whole glans area, and that's how it's seen. And the typical clinical appearance also, when you attempt to pull the skin in a typical congenital one, there will be a uniform size circular opening. When it's an acquired, you will have asymmetrical opening. Some areas it will be thicker, some areas it will be less thicker, and that's how we have to make out these acquired or congenital. Of course, history also will be helping to do that. And in the treatment also, treatment protocol also, there will be slight difference in the approach. We will discuss more about that during the treatment as well. Then comes the Saniruddha Buddha. सनिरुद्धबुधैः वेगसन्धारणात् वायुः विहतो बुधमाश्रितः नीरुनद्धि महास्रोतः सूक्ष्मद्वारं करोति च मार्गस्य सूक्ष्मात् कृच्छ्रेण पुरुषं तस्य गच्छति सनिरुद्धबुधं व्याघ्रं एनं विद्यात् सुदुस्तरं. Saniruddha is a narrowed anus. Narrowed anus could be either anal stricture, which is an acquired pathology, or imperforate anus, defects of the imperforate anus, which are congenital, may be considered as Saniruddha. Now, Sushra has not mentioned whether it is a Sahaja or the other way, whether it is congenital or otherwise. But as the description is mentioned about the etiological patterns like due to the Vega Sandharana or so on, is about the acquired condition. So I would be considering the Saniruddha as anal stricture primarily, and in the it's because of the narrow, and often it's a complication of handling, surgical handling of the anus. Hemorrhoidectomy often result in the strictures there. Strictures also can be a consequence of inflammatory disorders like colitis, proctitis, etc. And it has to be differentiated from the tumors. The tumors are the other conditions which need to be differentiated from the clinical point of view. When you put your finger into the anus, you can make out, or at times you may need a these investigations with a proctoscope to confirm about that. Imperforate anus, congenital one, they could be of different degrees. Either it could be a partial or complete, depending on the degree. And in case of that, the incomplete or complete ones, where there could be different sort of the connection of the imperforate anus, there may not be any opening at all. But only in a few of the conditions there could be an anal opening which may not be having a direct connection with the anus as anal canal, or there could be some membrane-like appearance. So these are the different degrees of imperforate anus. So maybe this also may be considered as the Saniruddha Buddha. That's all the point. Then the next is about Ahiputana. Ahiputana is a शकन्मूत्र समायुक्ते अधोते अपाने शिशोः भवेत् शिन्नस्य आश्राप्यमानस्य कण्डूः रक्तकफोद्भव कण्डूयनात् ततः क्षिप्रं स्फोटाः श्रावश्च जायते एकीभूतं व्रणेः घोरं तं विद्यात् अहिपूतनं, which is also called as Dobie snitch or napkin rashes, which is rashes, that is spelling mistake, typing error. Now it's often produced with unhygienic conditions of the genital area, and we usually use the diapers. Diapers considered to be the cause for the hygiene, but they themselves could be cause for the itching. So Dobie is also produced the diaper rashes or napkin rashes, which are common now, and such conditions are exactly ahiputana. When it becomes a big ulcer like that's called as ahiputana. Vrishana is a similar lesion in adults. See, ahiputana is in children. In adult again, similar unhygienic condition, स्नान उत्सादनहीनस्य नरो वृषणसंश्रितः यदा प्रकृत्यते स्वेदात् कण्डूं सञ्जनयेत् तदा तदा कण्डूयनात् क्षिप्रं स्फोटाः श्रावश्च जायते प्राहुः वृषणकच्छुं तं श्लेष्मरक्तप्रकोपजां कफरक्तजव्याधि where there could be a unhygienic conditions in the skin, and hence it results in the irritation of the skin and produces severe itching, usually be attributed to the fungi. The tinea cruris is the usual fungus which is responsible for that, and it's a very frequent event, and the basic reason is unhygienic conditions, or at times it could be irritation due to the powders which use, the silicon containing powders which are used can also be a cause for the irritation over there. Then the next is about the Gudabhramsha. Pravahana Atisarabhyam Nirgachati Gudam Bahihi Dukshadarbala Dehasya Tam Gudabhramsham Adiched. Rectal prolapse. Rectal prolapse again could be either partial or complete. So the basic differentiation between a rectal prolapse and the hemorrhoidal prolapse is when you palpate, you can feel that four layers, a coat over this shirt appearance. This is what we usually see, that four layers can be palpated. It could be partial or complete. Primarily, the rectum is sustained within the area because of the suspensory structures. Among those suspensory structures, levator muscles and the adipose tissue in the hysterectal area are the most important compact materials which can keep that rectum inside as such, prevent the prolapse. One of the very frequent cause for the rectal prolapse is a sudden weight loss, like when the fat in the extrarectal fossa gets reduced, it can produce the displacement. Of course, sphincter muscle tone also is the other factors which can produce the rectal prolapse. Patients who have diarrhea-like conditions also have a tendency to have the rectal prolapse due to the continuous stress. So either it could be the reduced fat content, which allows the rectum to get through or get passed through as a, or abnormality of the sphincters, or at times it could be continuous high pressure movement which could produce the rectal prolapse as such. With this, we conclude the kshudraroga chapter. It is Sushruta Samhita Nidana kshudraroga Nidana Nama Trayodashodhyayah. If there are any questions, I will try to answer and then wind up today. We will continue in the next sessions. There are some questions. In Charma Kila is keloids, then what is the understanding of Vranagranthi? Vranagranthi is the same name for the same. Mamsakandi is different. Mamsakandi is mentioned in the this Kantagata Roga or Galagata Roga as such, where the palatine is disorders are called as Mamsakandi. But Vranagranthi and the Charmakila are the same is as such. Then how to differentiate Khalitya due to Pittadika and Kapha Avarana? How see that Kapha their lakshanas like itching, as in case of the tinea cruei, could be the Kapha lakshanas. Absence of the itching and simply the hair loss could be due to the other causes as well. That's how we can make out the, to identify the dosha lakshanas. We need to identify the clinical symptoms. That's all the point. Like then management of Khalitya and Kaphavarana Khalitya, of course, management part we will discuss when we discuss the Chikitsa later on. So we will discuss. Mamsakandi is mentioned in the complications of Asamek. Okay, that's also true. Asamek Chedana, that's also true. Mamsakandi is mentioned in case of the Vrana complications. That's a hypergranuloma. Hypergranuloma, where the granulation tissue becomes hypergranular, that's also called as Mamsakandi. Is mentioned in the Vrana Chikitsa, of course, it is true. And it could be a treatment for with Chedana. That's it. Right. So, right. That's about the question answer. Right. So we'll conclude today. Fine. Thank you.